Practicing in Singapore after BDS in India or doing MDS in Singapore is one of the questions we are frequently asked. So in today's video, we are going to answer them. If you are interested, stay tuned. Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our aim here is to help dentists succeed. To practice in Singapore, after your BDS in India, you have to give a qualifying examination. But there is one rule which makes it more difficult to practice there as compared to in other countries. What that rule is, I'll explain after explaining the qualifying examination procedure. The qualifying examination has three parts. In the first part, you have to give an MCQ based examination with three sections in it. Section 1 contains medicine, surgery, pharmacology and dental materials. Section 2 includes physiology and anatomy. Section 3 has biochemistry, pathology, microbiology and oral biology. In the part 2 of the qualifying examination, you will have to do two procedures on a dental mannequin. Procedure number 1 is preparing and restoring a class 2 cavity. Procedure number 2 is doing a crown cutting of a tooth and preparing a temporary cap for it. Part 3 of your qualifying examination includes two subcategories. One is your OSCE examination, that is the objective structured clinical examination, in which you'll have to go into different compartments. In each compartment, there will be one question. It could be either about a medical emergency or about a clinical diagnosis or pharmacologically based question. The second part involves assessment of your clinical skills by writing long essay type answers to certain questions. The cost of these examinations are for the part 1, 750 Singaporean dollars, for the part 2, 1,750 Singaporean dollars, and for the part 3, 3,000 Singaporean dollars. The catch out here is you have to clear all the three exams in maximum of 2 attempts, which need to be completed between the time frame of 12 months. So if you fail, you'll have to reappear the exam quickly and clear it as well. Before you give your qualifying examination, you have two things which you need to get done. The first is you have to prove your command over English by giving the TOEFL, the IELTS or the OET examination. If you're giving the OET examination, you need at least a grade B. If you're giving the TOEFL, you need to score at least 7 on each of the parts. If you're giving the IELTS examination, depending upon how you give it, the scores vary. If it's an online examination, you need a minimum of 100 marks. If it's a computer-based examination but offline, a minimum of 250. If it's a written paper-based examination, a minimum of 600 marks are required. But the bigger catch before giving your qualifying examination is you have to get a job letter. That means you can only apply for the qualification examination if there is a clinic or a hospital which is keen on hiring you once you clear that. So having a network there in Singapore is extremely important to try and get this job. The other route where you can give the qualifying examination without getting a job is applying for the Masters in Dental Surgery program out there. Now, the National University of Singapore provides MDS in the following subjects, that is endodontics, orthodontics, oral and maxillofacial surgery, pediatric dentistry, periodontology and prosthodontics. To apply for the MDS programs in the NUS, you have to submit your transcripts and all the required documents given on their website. It also requires you paying a fee of 50 Singaporean dollars for the process. You also have to clear the English examination, which as stated above could either be IELTS, TOEFL or OET. For most of the subjects except oral maxillofacial surgery, based on the letter of request they get, they would decide who is the best candidate suited for it. If required, they will also conduct interviews before finalizing the MDS students. However, for oral and maxillofacial surgery, you also have to give an extra examination. That is called the Part 1 MDS examination. The Part 1 MDS examination includes one MCQ based question paper, one essay based paper, also oral examination. It would cost you 300 Singaporean dollars for giving the examination. If you want to prepare for it, they also have a course related to it, which would cost you 1,200 Singaporean dollars. Then coming to the most important point, the fee structure. If you are going for any subject other than prosthodontics, the current fee structure would cost you 95,000 Singaporean dollars per annum. It's a 3-year course. If you're going for prosthodontics, it would cost you approximately 99,000 Singaporean dollars per annum for 3 years. Other than this, you also need to have 18,000 Singaporean dollars per annum for your lifestyle expenses out there. So when you apply to this university, you have to show them proof that you have complete funding, either through loan or otherwise, for the 3 years duration, that is for paying the fees, also for your accommodation and lodging out there. The next question a lot of people would ask is, will I get a stipend? The answer is, you will not get a stipend out there. The second question which is commonly asked is, can I do odd jobs or work part-time while I'm studying? The NUS completely forbids you from doing so. So you cannot work part-time as you're studying out there. But when you're doing your MDS, you can apply for the qualifying examination, and in this case, you need not require a job offer from a clinic or hospital out there. Before deciding whether Singapore is the right country for you to move abroad, I hope you've seen all our videos. That includes Germany, UK, UAE, Canada, Australia and New Zealand. Look at all the options before deciding which country you want to settle in. I hope you got a lot of information from today's video. If yes, do not forget to hit the like button below. And I'm sure you're subscribed to our channel because we'll keep on coming up with content like this. I'm Dr. Satish Kumar, this is Kaizen Dental. Our aim here is to help dentists succeed.